Hi, welcome to Mental Health Matters. I'm Shannon Eliot. Today I'm joined by two experts on the unique and complex issue of refugee mental health. Dr. James Livingston is a psychologist and the clinical services manager for San Jose's Center for Survivors of Torture, a project of Asian Americans for community involvement. He treats and conducts research with refugee torture survivors. He has worked as a clinician for over 30 years and is an adjunct professor at Alliant University, San Francisco. Jamila Ghanm is originally from Baghdad and is an active member of the San Jose Iraqi community. She is known for her work in helping newly arrived Iraqi refugees successfully integrate into society. In 2010, she co-founded a project to establish Iraqi service providers. She also served as a human rights lawyer and legal case manager with the Iraqi Ministry of Human Rights from 2004 to 2008. Welcome, Jamila, and welcome, Dr. Livingston. Thank you for joining me today.
Thank you for the opportunity.
Jamila, can you get us started with telling us your story of how you came over here and what kind of mental health issues you faced?
My name is Jamila Ghanm. I came from Iraq, Baghdad, 2008 with my family, 2 kids and a husband. Before I came, I worked as a lawyer in Iraqi courts for 7 years. Then in 2004, I worked with the Iraqi Ministry of Human Rights with the American Forces violations. Then after, the unstable circumstances and a war environment in Iraq, and my father-in-law had been kidnapped by the terrorists, and there is a lot of instability and lack of services, so we decided to come to the United States as refugees. So we came here, and when we first came, I experienced a lot of the mental health issues, such as homesickness, depression, and stress, and shameful to use food stamp and public self assistance, like medical and food stamps. As a professional, I was very active member in my community in Iraq. Then I came here to be a housewife, which is very stressful for me. So for 1 year from my coming, I suffering a lot of mental health issues. Then I was under stigma of mental health, so I refused to get any mental health help and services. Then after 1 year, because of a lot of challenges of adjustment, like lack of language barriers, and there is no communication with the people because of the language barriers and the stress that I get after I get here, and I have to rebuild myself and to start over as a newborn baby. I get lost in this new world. Then after 1 year, I had a very strong conversation with myself. I need to figure out my way here. I started as a professional in Iraq, and I need to end up with a professional in the United States. So I got out from my stress and mental health issues. I started with the first step, which is go to the community college and improve my language skills. And that way I started to meet new people and new friends, and I improved my language skills to communicate with the amazing people around me. They were trying to help, but because of the language barrier, there was a lack of communication. And after, I improved my language skills, I got out in the community and, meet with the ACI's staff, CST, Center for Survivor of Torture, at first as a friend, because my husband worked in their, agency. So I started meeting with their staff, who are very amazing and helped me a lot to get from my mental health issues.
So how did your family support you through all of this?
You mean in my family in Iraq or here?
Family here. Because I mentioned,
Actually,
I know.
Of course, their understanding to my situations and, what's going on with me, that's, helped me a lot. Of course, my husband support me a lot, and he was, advising me to seek mental health services. But because of, mental health stigma, I was refusing to get any services. And always I'm telling him, do you think I'm getting crazy to ask me for getting mental health services? No, I was, I am an educated person, and I worked with the human rights issues, but unfortunately I had mental health stigma in the beginning. But after that, after I get help, and I realized and recognized how important for people who are new in this community to get mental health services and help to rebuild themselves and to be stable and adjust in the new community.
Dr. Livingston, what are some of the most common mental health issues faced by refugees?
Well, refugees are coming from their home countries because it has become impossible to continue to live there. And so they are involuntarily leaving, as opposed to immigrants who choose to come to the United States. So there is oftentimes horrible things they've gone through in their home countries. They typically transition through several intermediary countries before they arrive at their host country. So the refugees arriving in the United States typically have already been through a great deal and oftentimes are experiencing trauma symptoms. Once they get here, they are faced with a new culture, a new language typically, a new world. And they're unfamiliar with just about everything. So they then experience the trauma that immigrants experience in transitioning from one culture to another. And it's a difficult process. Most of our clients, particularly those who are torture survivors, have both traumatic symptoms and depressive symptoms, and they need treatment for both of those things. They can have other kinds of anxiety disorders, panic attacks, anxiety problems of that sort are common. It also is not uncommon for people to use cultural solutions for their symptoms, and sometimes that means using alcohol or other drugs. And so substance abuse is at much greater rate among the refugee population than in the general population. And then there are other kinds of social problems that are heightened by all of the stresses that also are present among that population.
So in a way, it's just a self-perpetuating cycle.
Well, there are so many stressors, and it's astonishing to me that people are able to stand after they have gone through so much.
Because you could be fighting the trauma that happened to you at home, and then the obstacles getting here was not easy, and then finally getting here, and like you said, Jamila, not being able to speak a language, and you were this great professional in your home country, and here suddenly it's a whole new life that can't be easy.
It's the new challenges.
Yeah.
We just, exchange our challenges and, back home with the new challenges here. So it's kind of exchanging the challenges.
So Jamila, I'm curious, with your perspective, having lived in these two places now, how does the culture around mental health, what are the similarities and differences between mental health in your home country of Iraq and here?
Big difference because, back home in Iraq, whenever you say mental health issues, that, directly goes with the craziness because, we have a big stigma against mental health, and you never can say, mental health issues because people, directly goes with the craziness. So even people, when have any simple mental health issues like anger or, child abuse or domestic violence, anything, stuff like this, they can't talk about it because they feel shame. While here, the situation is different. It's, more open-minded for this term. And there are a lot of services, and many different kind of agencies, and even the government, offer this kind of help, and even people, more understanding for this situation.
Did you say that it was okay to be depressed?
Yeah, the
Right.
umbrella term for the mental health issues in Iraq is depressed. It's so easy and acceptable term to say I'm depressed, I'm stressed, but no mental health issues.
So depressed kind of just means stressed out and you need a break, as opposed to I
Yeah,
have a mental
which is
health
very
issue.
usual. It is very usual. It's not shameful to say I'm depressed, I'm stressed, or whatever, but no approaching to the mental health. Don't say any mental health term.
That's really interesting.
Yeah, it's kind of umbrella term.
Dr. Livingston, how do these issues differ between youth and adults?
Well, there are a variety of differences. Typically, kids learn the new language much more rapidly than their parents. And typically, the kids are with other children in school, and they rapidly become acculturated. They want to be like the other kids. They adapt and learn very quickly. And I figure that if they've been in the country more than a month, they're California kids. Certainly, many of them come with trauma that they have been through themselves, and that affects the process of adjusting. Many of them have parents who are themselves traumatized, and that changes the family circumstances and affects the children. But overall, it's a much easier transition for children than it is for adults.
How would you vary your approaches in treatment if you're working with a child or a young adult versus older adults?
Well, it depends on the issue that we're trying to work on. If it is a trauma kind of reaction, the thing that is confusing to many professionals is that what actually happens to a person, children, isn't what injures them. What injures them is what they understand to be happening. So if they are in a circumstance that an adult might not regard as being particularly dangerous, but the child believes that it is dangerous, they're likely to be traumatized. And conversely, if they're in a life-threatening circumstance, but they don't regard it as that, they typically are not traumatized. So one of the first things that a child clinician is going to be doing is finding out how the child has interpreted the experiences that he or she has been through.
So it's extremely subjective and personalized from person to person.
It is. It is. And it's important for adults to understand that what matters is not objective reality or adult appraisal of the circumstances. It's what the child understood to be going on.
This next question is for both of you. What are effective ways that refugees can take care of themselves?
Actually, from my experience working with the refugees, first of all, most of new arrivals from Iraqi community, they need, mental health services because they are, coming from the war environment. And absolutely, they have a trauma. They have a lot of, terrible experience that they went through. So the first step that they can take care of themselves to seek mental health services. How is that? We need to, figure out what is the right approach for, different kind of categories in the community. Because out of my experience, I divided the community to 3 categories, which is women and men and youth. And each of these categories has, different kind of approach. For example, women prefer social events or social gathering or some stuff like that. And they are more open-minded from men. Men prefer, sport activities and, entertainment things, and they very close-minded, and it's not hard to get them and, to share their experience. And youth also have different kind of, activities that you can approach them, which is, entertainment or sports or kind of, social events or like, dance parties or, sport competition or like this. So first of all, we need to educate them about mental health issues. We need to, reduce the stigma among them. Then after that, we're gonna ask them, to help themselves by asking for the mental health services.
Well, research suggests that the single most important step in becoming adapted to a new culture is learning the language. And that is one of the things that we emphasize with our clients, that the more fluent they can become in English, the more opportunities they'll have. It's not possible for some of our clients to learn English, not because of intelligence or motivation, but because if they are severely traumatized, we are starting to understand that that has biochemical effects on the brain that actually changes brain structures. And some of those structures are involved with the formation of memories. Some of our clients are physically incapable of learning English. But to the extent that that's a possibility, that's really a crucial step in becoming familiar, becoming able to feel as if one belongs. The second most important thing, I think, is finding a community to feel part of. And that community oftentimes is a faith community. It can be a linguistic or ethnic community. It can be an educational community. It, in my experience, really doesn't matter. There needs to be some community where the individual feels like they're a part of it, they belong there. And that is hugely important in becoming adjusted to a new world.
That's interesting you mentioned that, because when we were speaking earlier, I know you mentioned for some refugees, particularly parents who have children, one source of distress might be that their children are acclimating too well and they might forget customs or ways of, their home country. Have you ever felt this way, Jamila?
Yeah, I totally, agree with what Dr. James said and mentioned, which is very important steps for the new arrivals to take to, heal or to adjust. But first of all, the major problem that, new arrivals, I'm talking about, new Iraqi refugees, is the stress and depression and mental health issue. Unless we treat these, kind of mental health issues, they can't go out, they can't learn the language, they can't, engage with the community. Because from my personal experience, when I was, under stress and mental health issues, I, wouldn't go out. I wouldn't meet people. Even there are a lot of American people trying to approach me, trying to help and communicate with me, but I was refusing to engage with them because, I had mental health issues. So before, any refugee take any of these steps, learning English or engaging with the community, we need to, get them mental health services first, to get them from, the culture shock, to get them from stressors and, mental health issues that, for new arrivals. About, the kids and adjustment and, kind of challenges between, two cultures, which is our own culture and American culture, yes, I am suffering. I'm telling you, because this is very hard. The kids, are very welcoming and, very acceptable for the new culture and, so fast to engage and adjust, which is, kind of dangerous for the parents, because in this way they're gonna lose their language, they're gonna lose even their religion or their, culture. For the parents, they need, their children to, touch or, to stick with their culture and religion and language. So yes, I am fighting with my kids, not in, hard way, but it's nice way to, engage them in Iraqi community, take them to the religious places, and, register them for the Sunday school to, to the language and the religion. So it's kind of challenging for the parents to balance the two cultures.
And it's a challenge for any parent anyway, just to...
it is a big challenge. Because for the kids, it's so easy and, they are willing to go out and engage in the new culture. And, because of the new, things which is different from their culture, it is, more open and, more exciting. So they are willing to go out, and participate in these kind of activities, which is sometimes prohibited in our culture.
Right.
For example, for my daughter, she's now 12 years old, and she wanna, sleep over. She wanna, go dance group with her classmates, or So it's kind of not prohibited, but it's unacceptable in our culture to let the girl in that age to go out alone.
Right.
Yeah. So it's kind of.
You probably have to do a lot of research to learn about youth culture to see what your daughter wants
Yeah,
to do.
of course,
and so that's a whole other layer of...
we need to balance.
Right, right.
It's also a challenge for the kids.
Yeah.
The children, the adolescents oftentimes feel caught between the two worlds, and they don't want to cause their parents distress, usually. They understand that their parents typically are having a more difficult time adapting to the new culture, and don't want to upset them. At the same time, they want to fit in with the other kids, and they want to have the fun that the other kids are having. And it's a real challenge for them to figure out how to navigate those two worlds.
So how would you guys say that peer support from other refugees helps in mental health recovery? I know you were among the early ones to get here, and you didn't have really much of a network then, but you're creating that network for other people now. So.
Yeah, actually, because I suffered from the loneliness, so I have to figure out a way to engage with the, my community members at least. So I figure out to establish, group gathering. So I start to visiting new arrivals, invite them to my apartment, even it's a small apartment, but I, was welcoming them and, cook food and share the food, share the chatting and challenges together in order to reach the solutions. Fortunately, my husband has a great experience search internet. So whenever anybody from new arrivals has any problems or any challenges or ask about any program, we can search the Google it, and search the internet to find what kind of services and programs that can benefit the new arrivals. So we create or established group gathering first. Then whenever the group become bigger and bigger, we establish community gathering outside, maybe go in a picnic or some community places that we can gather together and chat and share our experience and our challenges. Yeah, so that was very important step, because whenever people see other new arrivals have the same challenges and have the same issues, it's become not shame to talk about it, and you might they might get benefit from the experience of others, or there is some services or programs that can benefit others. So we were sharing the resources and sharing the experience in the same time, and it's kind of way of healing.
Have you seen a change in sort of the attitudes and culture around mental health from the other Iraqis who have come over after you? So you've created this group and promoted discussion. Have they started opening up more, and do you see a change in that?
Yeah, especially with the women. Yeah,
Really?
I create a tea party every month for women, and we sit and share our experience, and they start open and talk about their domestic violence, child abuses, and anger issue, and some stuff like this, which is mental health issues. Then I start to talk to them about there is a lot of services available that you can ask. If you don't want to get any legal trouble, you have to ask for counselor or for any advice to help you how to deal with these issues. And you can get, of course, mental health help. Yeah, so it's more beneficial for my community members. For the men, it's hard to reach and hard to get them talk about their experience. But I use some community members, which is men also, to reach this category, and also create some sport activities, like soccer or something, and when they get rest, they're gonna talk about their issues. So it's kind of way of healing.
So Dr. Livingston, it certainly sounds like a proven method for success is these community events, but are there any other sort of specialized treatment techniques that you use when working with refugees and or survivors of torture?
Typically, what we have tried to do is utilize community resources and access new arrivals through those resources, things like community centers, faith centers, and we sponsor some events of our own in terms of parenting in the United States, or various issues that might be of concern for people newly arriving in the U.S. We have had the good fortune to be given a grant in the last few years to investigate different delivery methods of mental health services for the 9 major ethnic groups in our county, Santa Clara County. And so we've done focus groups, and we've talked with community consultants to try to figure out culturally acceptable ways of delivering information and offering services. And we, not things that I certainly came up with or necessarily any of our staff, but we have been involved with, sponsored a lot of activities that I never would have thought of with our Ethiopian and Eritrean communities. We had one event where the immigration process was described in the form of dance, and the adjustments and so forth were all exhibited in the dance, which is not a medium of communication that I'm experienced with, but I gather was quite meaningful for that culture. And we've been fortunate to have the opportunity to have consultants who guide us in non-traditional ways of service delivery.
So Jamila, to wrap us up, how are you doing now and what do you hope to achieve in the future?
Well, I'm doing well now because, of my amazing friend around me and because of the help of Center for Survivor of Torture. They helped me a lot, so I'm feeling well and good. And I'm still working with the Iraqi community members in order to reduce mental health stigma and, advise them to use the mental health services that available because I realize this is very important from my personal experience. So my future plan is to get a master's degree in humanitarian international law, maybe get work with humanitarian or something like this field. It's away from legal stuff. And still working with community member because I consider myself, as a messenger. I have a message, I need to deliver this message, which is very important for all the new arrivals.
You're very inspirational. I just wanted to say that
Well,
before we
thank you,
leave.
appreciate it.
Well, thank you, Jamila, and
Thank
thank
you.
you, Dr. Livingston. I've had a great time talking to you, and I appreciate it. Best of luck to you both.
Well, thank you.
Thank you.
To learn more about the Center for Survivors of Torture, visit their website at cst.aaci.org. Survivors International is a San Francisco-based organization that provides psychological, social services, and medical services to survivors of torture, war trauma, and gender-based violence. Learn more at survivorsintl.org. If you would like to learn more about the mental health of refugees, check out a 1996 report issued by the World Health Organization. You can read or download it at unhcr.org. Thank you so much for watching. We'll see you next time.